Hi, my name is Shreeya Bukka, and my literature review was about the benefits of Medicare for those who struggle with Alzheimer's disease and dementia. So, a little bit of background information on Medicare, Alzheimer's disease, and dementia. Medicare is a federal government insurance open to those who are 65 years and older and come in mostly three parts: Part A, Part B, and Part D. Part A covers nursing homes and hospital stays, Part B covering medical supplies and specialized doctors like neurologists, and Part D covering prescription drugs. Medicare does not cover all costs, but it can help, like any insurance, help a beneficiary pay. And Medicare does offer premium services, for example, like Medicare or special needs plan, which both of those can help cover those extra, like deductibles, co-payments, co-insurance, stuff like that. So, a little bit of information on Alzheimer's, which is a neurological disease that affects motor skills, memory, which requires more intensive care throughout the stages, and dementia, which is a general term for memory loss and impaired ability to think and remember. So AD and dementia both require costly medical care and monitoring, as well as many diagnostic tests to rule out symptoms to diagnose a patient with Alzheimer's disease or dementia. So with that, my research question is, what are the benefits of Medicare for those who struggle with Alzheimer's disease and dementia known from the literature that I researched? So for my research, a couple of methods that I came up with mainly was to divide my main topic into three subtopics, being Medicare, Alzheimer's disease, and dementia. And then what I did is I went out and I researched at least one source per subtopic. I ended up with 2 or 3 per subtopic. And this was basically to define and go into depth and detail so that I could understand and I could write that in my review. For example, with Alzheimer's disease and dementia, I went to specific associations and care group websites that helped define and describe Alzheimer's disease and dementia. And for Medicare, I went to government websites to see what because it's a federal government insurance, so that really helped with that. I used Google Scholar for specific researches and specific sources out there. And I also used search operators like and, or not, or to help rule out certain things. In the middle, you can see a graph here that shows Alzheimer's disease cases in the US in ages 65 years and older from 2010, 2015, and 2020. So in 5-year gaps, and you can see how the cases have risen from 4.7 million, 5.3 million, and 6.2 million in these years. So with my results, I ended up using 8 sources, and the result of my research concluded that 6 million Americans have developed dementia because of Alzheimer's, and that AD is the 6th leading cause of death in the US. So my research also showed that AD requires family care and help in a support system, as well as the disease progresses and as it gets much more severe, that 24-hour care can be necessary at one point. So this disease, its effects on people is completely unpredictable, as somebody may have terrible disassociation and somebody may just have a dementia developed from AD. So with the help of Medicare, it can help beneficiaries find care plans or even financially take care of their plans and their costs. And as I explained, the 3 main parts of Medicare specifically show each part, in this case for Alzheimer's disease and dementia care, and how it can help cover those costs. So in my literature review, a little synthesis of that is, because AD and dementia are diseases that require lots of care, tests, and are very unpredictable, it can require many doctor visits and expenses. So Medicare, with its 3 parts specifically for this disease or dementia, with Part A, Medicare covers 100 days of nursing home stays or 35 hours a week maximum of homebound care. With Part B, Medicare can help cover the costs of neurologists or therapy, and with Part D, throughout the Alzheimer's disease, there can be prescription drugs to help slow down the progression of the disease, and that can be covered with Part D. So, in conclusion, my goal of this literature review was to show that with Medicare, families and patients can help cover expenses of AD and dementia care and treatments, as well as treatment for plans and therapies, and not just for the beneficiary, but for their families. In the future, because clinical trials are covered with Part B and Part A of Medicare, with Medicare and with this insurance, clinical trials researching and focusing on brain tissue damage and shrinkage, which is what causes dementia and Alzheimer's, can help doctors and people more efficiently and more easily diagnose Alzheimer's disease and dementia, because as most of the time, by the time a person is diagnosed with AD or dementia, a family does not have time to prepare themselves financially or emotionally for care for this person that they care about. So having more time and being more financially prepared can help families when you more efficiently or quicker diagnose a patient with Alzheimer's disease. Thank you.